information that you would like folks to put together or that you strongly suggest, is it best to keep it on the shorter side so it's more condensed, maybe 2 pages rather than 15 pages?
Yeah.
As we want to write anything and everything.
Yeah. Thank you. Yeah. Thank you for that. And I just, as you were talking, I was kind of looking at my notes to see what I forgot. So, first of all, less is best, because if you start handing somebody more than 1 or 2 pages, chances are no one's going to look at it. So you want to highlight things. And so you want to talk about the most important things. We're not giving a full medical. We're not saying they had their tonsils out when they were 11 months old and they had tubes in their ears at this age. Okay. We're talking about right now, my child is going to be in the hospital without me. You have got to know this. You have to know this. And so for some people, if your child or loved one doesn't use words to communicate, these are really important things that I want to have you just start thinking about. What calms your loved one? What agitates them? Mm-hmm. Do they have something that causes them pain? And one mom said something so interesting to me, so I want to repeat it. My child groans and moans when they're happy. It calms them. It's very soothing to them. And so I don't want the physician or the nurses to start pumping them for medication thinking they're in pain, because this is something that's helping them. So, my daughter doesn't do that. I would never have thought of even raising that if I didn't talk to this particular parent who was concerned about things, right? So you do have to really think about your loved one and what's important. The other thing is, if it's at all possible, attach a picture to that. Put it on their chest or, tape it to them. But the reason I say that is they're going to go into the hospital and this wonderful staff is going to be overburdened and overworked. And that when you go in, you're leaving them of so much of those guessing games and things that they may need, right? So what you want to do is make sure that the nurses know that this is not just a patient. This is not just a sick person. Okay. You want them to know this is a loved one. This is a son, a daughter, a cousin, whatever. So the picture that you put in, that first picture is important because it shows them when they're healthy and when they're not in pain and when they're not scared and frightened. And that's something that the people who come in and out of the room might say, oh, there you are. Look at you doing. Or is it your mom with you or your dad or your brother, whatever.